Hello, friends. So, we're back with another episode of the Well Balanced series. Today is a unique conversation. It's actually with Crystal, who is local to me in Atlanta. But we've connected just from events that we've done and other things. But she's a doctor of physical therapy. And I'm super pumped to talk to her because it's about pelvic floor health and all of that. And it's just something that I don't know a lot about. So, I'm definitely very interested in hearing from her, learning, and hopefully implementing some of those tips in my life. So I'm gonna lead her in here, and here we go. Nope, maybe not. Okay, let's see. There we go. Hello.
Hey, how are ya?
Good. Can you hear me okay?
Yeah.
It always changes the position when someone joins.
Yeah,
Okay.
I know. I'm readjusting this.
I know. It's she can't be too close, can't be too far. All right, there we go. What's up? How's your Tuesday?
Yeah. I may need to turn off my Wi-Fi, so if I get lost, just, I don't know, text me.
Okay. Well, I won't be able to text you because I have to shut the live down if I do that. So
Okay, so never mind. Yeah, okay,
just
gotcha.
hop back in, but you should be fine. I'll just wait
Okay.
and see if you come back in. But yeah, so how is everything? How's today going? Sorry, hold on.
It's
Let me just
good. No, you're
there we
fine.
go.
I'm actually at work, so which is in active core in Druid Hills, so that you might hear some talking through the walls. It's a Pilates studio and a physical therapy clinic, so it's actually really busy. Usually in the first part of the day, lots of teaching going on, so you might
Nice.
hear echoes.
Cool. Well, my husband's on a call too, so I'm sure there's
Yeah,
just the life of being home. Um, but okay, so first and foremost, I want to do an introduction to you, obviously a little bit about you, what chose the path that you're in now, and obviously what you're doing in your career and kind of, starting there.
absolutely. So, again, my name is Dr. Crystal Fannin, and I have been doing physical therapy as a licensed physical therapist for 5 years now. Before I became a physical therapist and through school, I really enjoyed personal training, working one on one with folks, also teaching group exercise classes. I also did sports like basketball and track and field, which was my favorite. So I've always enjoyed an active lifestyle and I enjoy helping people so much, whether that's getting them to move better, feel healthy. And I'm so happy that I get to do it in a rehabilitative way. Unfortunately, it's not a matter of if we get injured in our life, it's a matter of when, and to walk with people and guide them from their conditions or things that they're suffering from, literally from head to toe, musculoskeletally. Help people get back to their activities that they love to do with less pain. So I used to, I'm basically an orthopedic physical therapist, meaning I work on everything muscles, tendons, ligaments, bones, and trying to get the movement system better. But recently, I've expanded my education to also involving the pelvic floor. It's not something that we talk about in physical therapy school from a very in-depth perspective. It's like, all right, this is what the pelvic floor is, and this is, connected to your hip bone and connected to your spine and to your
Right.
legs, but never internally, similar to what we may know as going to the gynecologist for annual exams and things like that. It's also for a completely different reason that I, know more in depth and trained to do assessments there. So I can go into more of that, but that's kind of my trajectory. And I'm also a yoga teacher. I just love to do that on the side. So
You're a full show, man. You got everything going on. I love
yeah,
that.
yeah,
So, yeah, I think the pelvic floor is something I definitely am not tuned into at all. So, I think it's very intriguing to learn more about that. So, first and foremost, what kind of got you to choose that as an additional route for yourself? Is that common for most physical therapists, or what exactly, does that look like?
I actually think pelvic floor physical therapy is rising, especially since the pandemic. I think most most female physical therapists have the potential to move into that if they are orthopedically trained. But there still needs to be a lot more education about it.
Right.
And the reason why I moved into it is there's a huge need, and Atlanta is massive. And there's like a pelvic floor physical therapist across the hall from me, completely different company. And there's like 7 within my 5-mile radius, and there's plenty of patients to go around. So it's not meant to like be alarming or scary, but as women or people who have pelvises with female parts, this also goes for men, but I'm just kind of focusing on the women on this platform. But there's so much that we can do, for our pelvic health prenatal, postpartum, if that's what we want to do, or if we're having issues with exercising and bowel and bladder habits related to that. And if you are having issues with that, you know who you are, or if it's affecting your level of connection, of intimacy and intercourse. I mean, these are like foundational things of our lives that sometimes going to other practitioners, they're not going to be able to help you get beyond that. So anyways, the bottom line is, I personally, I've learned so much more about myself after going through the training. But I'm lucky enough to not suffer with a lot of the dysfunctions that some of my patients come in with. But the bottom line is I get to help people like really get back to a functional daily living situation. And, and the list goes on. I can tell you what all that involves and like who that looks like who I treat for pelvic floor. But it's really debilitating if you're going to the bathroom 15 times a day, or if every time you sneeze and cough, you lose a little bit of urine, or you can't have intimacy with your partner, or, the list goes on. So it's super helpful.
Yeah, no, I think it's interesting because even in the program that I'm doing, it's like we're all talking about root cause stuff, and pelvic floor has come up a few times, and people have been like, wait, I never thought about that. And it was something, you can definitely assess things on, from a standpoint of like digestion and stress, that can affect blood sugar for sure, how like you're going to the bathroom and all of those things. But like, again, if it's still happening, there's clearly something else underlying there. And I think a lot of people don't think like, oh, I need to go check out a pelvic floor specialist. So in particular, like, do you see most women that are kind of on the journey for pregnancy or postpartum as like your main women that you work with, or is it kind of something that you feel like the everyday woman should still prioritize and still work towards, obviously, especially if they experience those symptoms you just mentioned, but from a person just kind of wanting to learn more, is it something that like it's never going to be unhealthy to go and learn about that?
100%. So definitely for the everyday woman, but what I'm seeing currently is either prenatal or postpartum or during pregnancy. We can even work on preparing for your pregnancy and your delivery, or I just combine labor and delivery. Your delivery. I like it succinct. So if you're pregnant, we can prepare for your delivery by working on relaxing your pelvic floor muscles. I actually have a little model,
Perfect.
which is awesome. So for the pelvic floor, there's actually 3 layers of muscles. There's tons of muscles, but there's 3 major layers. There's a superficial, intermediate, and deep. So here on the outside is the superficial, and these are your ischiums and your sacrum, spine, and this is looking from the top down, so on the inside of the pelvic floor here. And that is the deepest layer of the pelvic floor muscles. And that's so amazing because it holds up our bladder, our rectum, our intestines, our viscera, our uterus, our it holds so much. And so we can actually work on relaxing these muscles to prepare for labor and delivery. We can work on strengthening those muscles for those who either have urinary issues, like, again, stress urinary incontinence is when you cough, sneeze, or jump and you lose a little bit of urine, or maybe a lot of it, depending. Um, and then the second group of people that I'm seeing currently are postmenopausal women who are lacking those hormones like estrogen that actually create and help support muscle strength and function, especially around this area. And when we lose that estrogen, it also, relates to losing the muscle function. And so then we have an uphill battle, but it's, one that we can win. We can go up the
Right.
hill, but we have to work against losing those hormones. We have to work against age-related changes in muscle tissue to get that function back, because you do not have to live with, peeing yourself with exercise or feeling urges and things like that. So a lot of it can be helped, and a pelvic PT can help assess that on you. And there's a lot of great information. I can share like a bunch of other of my colleagues who have great like resources and programs. And, I know BirthFit is one of them. I love following Expecting and Empowered. They have a prenatal pregnancy and postpartum workout program that you can buy. And I absolutely love it. But what's important is you are you and I am me, and everyone's an individual and has different backgrounds and different movement patterns. And so it's really great to just know your own tailored body and what you may or may not need.
Yeah, no, bio-individual approach. I love that, because I think, people think, oh, I'm going to get the same thing as someone else, or what they did works for me. And it's like, no, it actually may not. And that's okay.
Yeah.
But, knowing that your journey looks a little different, but the end result is hopefully the same.
Yeah.
So explaining like a little bit more about like if I was to come into your space and to, start working towards strengthening those muscles or doing, certain things to improve that, what would you kind of start with people with? I'm sure it's a little overwhelming for people at first, and then like,
totally.
Kind of breaking it down and progressing. What does that look like?
Yeah. So as a physical therapist, just from a bird's eye view, I really look at three things. First, osteokinematic, which just means how are your joints moving? And that's from a global level. Like, let me look at your spine. Your pelvis is still connected to your spine, and so is your head and your neck. So I just want to see how your overall movement and joints are. And then from there, the second thing I look at is myofascial. So that's muscles and tendon in the fascia. If you guys don't know what fascia is, it's that thin layer of tissue that surrounds the muscles, large groups of muscles, and they actually connect in chains. So like my front of my shin fascia is technically connected to my quad, my rectus abdominis, my neck, and all those things. And there's whole chains of them. Anyways, those can get contracted and tight. So while I'm looking at myofascial restrictions that might affect someone's range of motion and their ability to activate muscles, including what's going on here. Can you imagine after having a child or a C-section, all of the myofascial restrictions that happen with a C-section scar, or with, obviously there's a lot of tearing that happens from the vaginal canal to the anus right here. Sometimes an episiotomy happens during delivery to allow for the baby to pass through. So anyways, there's a lot of reasons why there could be myofascial issues. And then the last thing, the third thing we look at is motor control. That's a fancy way of saying how well your body activates muscles. And when there's big changes in the body, like what females or women who get pregnant and have children that go through the body, I mean, there's different motor control. Same thing happens when you have regular surgery. Motor control can be altered in your body because either your brain forgot that connection to that muscle or that movement. And so with physical therapy, we're trying to regain that. So that's the bottom line, whether you're coming in for your pelvic floor or for your shoulder or for your ear. I'm not going to do anything for your ear, but like at least that stays the same. So if someone's coming in complaining of pain around their pelvis or their pelvic floor, or if they're having trouble urinating, or they're going frequently, or if they're having pain with sex, or if, the list goes on. For a pelvic health assessment, we can do it externally first, which is basically just looking on the outside, like I already do with your, range of motion. But in order to see how this muscle is functioning, I need to test it. Just like I would test, how strong is your bicep? Is it even turning on? Can it hold a contraction for 10 seconds, or can it do it repeatedly? Well, what about this thing? Now, this doesn't have to be super powerful, but we need to assess its function. Unlike the bicep, however, your pelvic floor doesn't have an opposite muscle. So like when I bend my arm, my bicep contracts. When I straighten my arm, my bicep lengthens, but my tricep also helps because it's contracting, So I know you get that.
I do.
With the pelvic floor, it can contract, but then we also have to teach it how to relax. And so that's why you hear the term Kegels. Kegels is just named after someone, which is doing a pelvic floor lift. Sometimes for people who have already tight pelvic floors, you're just making matters worse. So that's why getting an assessment to actually see if the pelvic floor tissue is going to respond to any lift is important. So anyways, that's the length tension relationship. You can relax the pelvic floor and you can contract it. So a pelvic floor therapist, when we're looking at the muscle function, when we actually go in and we just use one finger and we go in and we ask for a contraction or a pelvic floor lift. Actually, some people have a really hard time even knowing what that is. And I'm sure you can imagine after having a child or postmenopausal women who kind of just lose track of this function, they're not able to do it. So we're starting there. And then sometimes it's difficult to even insert a finger. People who have pain with sex can't insert tampons, anything. We're working on relaxation. And so again, here goes into the second box of physical therapy is the myofascial restrictions. Here's all this myofascial work that we can try to do to relax, both externally and internally. So that's what some people can expect to come in and have done. And then with that, have a very specific home program to say, all right, your muscle contracts like this. You're really good at endurance, but not good at the big, powerful contractions. Let's work on X, Y, and Z, or it could be something different for someone else. So I hope I explained that right, or like it's pretty thorough, but it's not scary. It's just another way to get these muscles to function properly. They're just muscles.
Yeah, no, I love that. So like how long does it take to see progress there? Like how through any of those things?
With a really good home recovery program, typically in PT, it's called like home exercise program, but it sounds like homework. But if we think about it like it's our recovery strategy, if we are educating our patients properly and they're doing these exercises, whatever that they need to do, whether it's relaxation or if it's contracting or if it's adding some of these contractions with functional movement like squats and lunges, if they're doing that and keeping in communication with their PT and those things, it can be resolved in weeks, but it's like multiple weeks. Probably it depends on the condition. Anywhere from 6 to 12, and that it takes 4 to 6 weeks to even see muscular strength and endurance gains in a muscle. So it's no different than with the pelvic floor. So it takes consistency on the part of the patient. But pretty much a lot of the pelvic floor patients are compliant because they are in such disarray from their
right.
pain and problem that they're like, I'll do whatever. And
Yeah,
so that's what it takes. Yeah, no.
And so like it's just something where, you come in and you're able to support it and strengthen it and do all that. And then let's just say you're done having children. So is it something that you can kind of keep up with on your own, or seeing a specialist every few months just to kind of make sure things are working? Is that beneficial?
Yeah, I think the idea is get empowered about your body, learn these anatomical muscles and just kind of learn what you need to do for you. So like, let's say if you're done having children and you're kind of on your way, you're probably good to go until I guess the next round of things hit. But I will say it's so common after pregnancy to have associated low back pain or other musculoskeletal disorders, or conditions, I should say. Um, Relaxin is the hormone in the body when you're pregnant that helps relax your ligaments and your soft tissues so that you can allow a baby to pass through. But that can also affect other tissues. That could affect your shoulder or your pelvis or your ankle. I've treated someone who, during her pregnancy, she tore her ACL because, it was, her body was pretty lax. So I say that now that you have a relationship with a physical therapist, they can also help you with those other things that happen. And unfortunately, this is the world we live in, but it's not a matter of if you get injured or suffer with pain, it's a matter of when. So if everyone took a preventative approach, that's great. If not, that's still all right. I'll help you on this end, whatever your problems may be. And, sometimes it's related to pelvic floor. Sometimes it's related to just your back and some orthopedic issues. So it's good to get checked out.
Absolutely. All about root cause prevention.
Yeah.
So like, what would you say is, I literally just had the question and I forgot it. Duration was one, and then what did you just say?
How like it can low back pain, other issues. You can look, you can come back to PT for other things. What should you do after pregnancy? I don't know. I'm trying to rack your brain.
I know. I was like, what was it? It was literally so good. I don't remember.
That's okay.
Maybe it'll come to me. Hold on. Nope, can't think of it. So,
okay.
Anyways, in terms of like lifestyle practices that people can do, at home, or ways to support the pelvic floor, like whether, I remember my question.
Okay.
Let me go back to that. I'll come back to that. So the original question was like, what are the consequences of, let's just say someone never thinks to check out their pelvic floor and like actually goes to physical therapy, what could occur long term if that's not addressed?
Well, so let's say like you're thinking about having children. If you get checked before having children, or starting that process, you can already know what you can work on, whether you need to lengthen your tissue or you need to do certain exercises to strengthen. But that can actually help with decreasing tearing or other birth related issues. And I don't know what those are because it's individual for everyone. You hear a lot of stories of people, for whatever reason, they plan for a vaginal birth and they end up having a C-section. And so it's just good to be prepared on all fronts. Also, as a pelvic floor physical therapist working in the realm of prenatal and postpartum, I am working with midwives and doulas, and we have other resources at your disposal if you don't know where to look. So we're just one part of the piece of, moving into that realm. Okay, so then you asked about consequences. So there are maybe some consequences to not being fully prepared for that event of having a pregnancy, and then dealing with some musculoskeletal issues later. But just like even preparing for surgery, like with a total knee replacement, getting prehab, getting exercises and strength around the joints as much as you can before the surgery, outcomes are so much better. So that's the way I look at it in terms of that. And then that's what I'll say for like the prenatal postpartum field. But if you're having pain with sex and you're having issues with going to the bathroom very frequently, like more than 10 times a day, those are behavioral issues, and you're just going to you're not going to want to live with that. So you're already seeking help, but you just don't know where. But pelvic floor PTs can help you. Even if let's say you're already seeing a practitioner or a doctor and they have you on medications or injections for whatever reason, going to a physical therapist or even a pelvic floor therapist will help that motor control aspect. Anytime you have injections, or someone cuts on you, or there's some altered mechanics there that can affect the way that you're moving overall. And if you're not moving well overall, over time, it's not a matter of if, it's a matter of when it breaks down. So that's not to be scary, but like just be proactive. And we're like the movement therapists, we're the musculoskeletal guides to like getting you back to what you want to be doing. And that includes your pelvic floor, what we're sitting on.
I love that. And I love that, you know, it's like on my end, it's, you know, I focus on the nutrition. I focus on, like I said, blood sugar, eating well and supporting those hormones and eating healthy fats that create the hormones and all those things that help to support the pelvic health on that end. But then I can't do what you do, you know, and I think how it's so cool how us can come together, practitioners just in general can really help to fill all those gaps and provide the proper support for women and men too, but you know, in this case, women mostly. But I just think it's people tend to want to go to one thing, you know, one direction only. Oh, is it still there? But then, you know, it's like, well, you may need additional support in other areas. And it's like, even like mental health therapy, you know, it's just, it's all together and I love it. So,
Absolutely.
There was a question. Do you want to answer that? What advice would you give someone who has fractured a hip?
I guess.
Thanks, Kwame. I went to college with him.
Oh, really? Is this a person with a male or female pelvis?
It's a male.
Okay, I know. I've learned so much language, right? Or I'm supposed to say a pelvis with a penis or a pelvis with a vagina, whatever. Okay.
Hey, open book.
A fractured hip. I'm so sorry you have a fractured hip. Lots of single leg activities actually help strengthen your femoral neck, which is, here, let me get Frank over.
Frank, come on over.
I don't know if you can see. This is your femoral neck. I don't know where your hip is fractured, but actually this is really good for postmenopausal women to hear, and just, you know, other women in general, anyone with a fractured hip. But single leg activity helps strengthen that because those glutes on the sides of your hip attach to the outside of your femur. And we do like single leg activities all day when we walk, run, climb stairs. And so first of all, starting with balance, again, this is going out to everyone. Everyone should do single leg activities. Starting with balance and just standing on a leg and doing like single leg kickouts, and all those things. But that's like a whole rehabilitative approach to the hip. And I also need to see like your lower back and all those things. But for postmenopausal women, hip fractures are so common. And also, like I said, low estrogen, low pelvic floor tone. But an active lifestyle helps support your muscles. It helps support your bone density and helps decrease the risk of falls and fractures and deleterious effects of inactivity. So everyone stay moving, stay on one leg, maybe practice some pelvic floor lifts and contractions. If you don't know how, call me and I'll help you. And men should be doing this too, because one day you might have to have a prostatectomy, which is like taking parts of the prostate away for whatever reason, for scopes or, you know, prostate cancer prevention. And then you'll have to come see me.
You'll just have to. Crystal's the one-stop shop. Okay, so
thank you for that plug.
So you kind of mentioned some things like single leg movements and, you know, all that stuff that can be helpful. So any other lifestyle things? That was my last question, to kind of, you know, support people during the day-to-day that they do, because I think, you know, maybe not everyone has the ability to work with someone like you, which is obviously the ideal route. But, you know, in terms of like things that they can do, or like you were saying, resources that they can go to in addition to learn more and all that.
Absolutely. Here are just some good bladder habits. Bladder habits are good to know so that we don't out-train them. And sometimes this is for the people who have urge frequencies. So like all of a sudden they put the key in the door and they know they're almost home and they're about to like lose their bladder, or, you know, they're about to fall out. Or if you put your hands running water and you can't help but like, oh my God, I have to go to the bathroom. So if you are an urge person and you're like, I have to go right now, but I just went, I don't know why, but I have a strong urge, taking deep breaths, diaphragmatic breaths, actually like squeezing your knees together or your legs together, anything that helps put pressure around the inner thighs or the perineum, which is just this is considered the perineum. Even just squeezing that a few times can help. I've told some of my friends too, who feel like they have a lot of urges, to do those deep breaths, pelvic floor lifts, also known as Kegels and whatnot, and just holding it helps the urge. For those who have stress incontinence, again, it just depends. Some people actually have both, so that's a little bit different. Just working on more relaxation, and bladder habits are avoid caffeine, alcohol, sugar, like chocolate, all the good stuff.
I mean,
but we can work our way back into those nutritional things, but those are bladder irritants. And so that makes people feel like they have to go frequently. And sometimes it's misdiagnosed as a UTI, but it could be just poor bladder habits. You should be going like 5 to 7 times a day, every couple hours. So that's a normal amount. I unfortunately am a camel because of the way that my work is. I see patients back to back and I'm like trying to get my water in, but I'm like, I can hold it. I can hold it. And that's not good either. And the just in case peers are teaching their bladder bad habits and other things. Also, the people who do the Texaco squat over the toilet because they don't want to put their bottom down, just wipe the toilet seat off and actually sit, relax, and allow your body to like release the urine, right? So those are for like the incontinence people. If you don't have any active problems, just practice some Kegels. I think it's great to get some contraction. The cueing, this is really interesting, goes, imagine like you're lifting a blueberry or a marble off of the floor with your vagina. Imagine like you're doing that. And there's different grades. I know I just did it. There's different grades of contraction. So you can like lift up, if you think of an elevator, you can lift up to floor 1, floor 2, floor 3, and then you can try to go down to floor 1. And then if you go to the basement, that's the relaxing. So it's like a bulge. It's like you're pushing to have a bowel movement, but it's good to have that excursion of all 3. So that's just a fun tip. Yeah.
I love it. That's great. I mean, I think that's very simple. And I think that the hydration thing is interesting too, because I touch on that with a lot of clients in terms of like going to the bathroom all day. And even if they don't have pelvic floor issues, it's they're not absorbing the water that they're consuming. So that's why it's so important to add minerals and to rehydrate with proper electrolytes, sea salt, and so that you're able to actually absorb the water that you're consuming versus just having it stream all the way in and out, because then your body's not doing anything with it and you're running to the bathroom every hour. So definitely how, the two things play a role together, I think, to give you optimal bowel movements in general. And just, I think it's cool to see that. So
absolutely.
Well, I loved this conversation for sure, and I'm definitely going to post it on the feed. But how can women get in touch with you? How can they support you if they're obviously local to Atlanta? How can they come find you? And any final things you want to share?
Yeah. You can follow me here at crystalhealing.pt. I work as a physical therapist under Active Core, which is in North Druid Hills. So you guys can feel free to message me, and I can give you my contact information from there. I have a YouTube that I'm like working on, so it's under Crystal Healing PT as well. And so I'm just trying to gain a little bit more traction, but the people are coming in, so it's good. I don't have time to do as much social media.
There you go.
So yeah, I also do, if you're local to Atlanta, I do free yoga in the park every second Sunday at Blackburn Park in Brookhaven. And it's just really nice to like decrease anxiety. I think the more that we fill up our own cups, that's what yoga does for me. We can give more to the world, but also like take care of our bodies and our nervous system. So I am talking to every single patient on my table about the nervous system, and like, we need to nourish yourself in many different ways. So come join me for that. Yeah, and just other thoughts is like, consider if you have any PT friends and you have any like injuries, no matter what it is, consider asking them, not for like free advice, but like where they should go. Too often, and I know with our healthcare system being bombarded, I just talked to someone earlier today, like it's a month to get in to see their doctor. Like, what's the point of having a doctor if you can't see them? But in the state of Georgia and most other states, there are some that don't. You can be evaluated and treated by a physical therapist for here in Georgia, at least for 3 weeks, and get some type of care. And the reason why we're doctors of physical therapy is because we're able to refer you out if what you're coming in with doesn't fit in our scope. So, you know, it's actually a cost saver to possibly see your movement therapist first, before going on to, you know, waiting a month for your knee pain that's getting worse.
Yeah, and I mean, you might as well learn habits that are relatable to your health in any way, you know, no matter, they're not going to be a negative towards your journey regardless. So
absolutely,
I think that's really cool.
Yeah.
Well, it was awesome talking to you, Crystal, and I will definitely have to come to yoga at some point in Brookhaven. But we'll stay in touch as always, and I'll post this to my feed, so I'll share it so you can share too. And I hope you have a great day.
Yeah, you too. Thanks, Kelly, so much. Have a good one.
Of course. Bye.
Bye-bye.